do continue giving you rolling coverage around developments that come from the East Rand, where police have opened an inquest docket into circumstances surrounding the explosion of the gas tanker in Boksburg, east of Johannesburg. This was yesterday. Gauteng Police Commissioner Elias Mawela says they are investigating a case of reckless and negligent driving following the incident in which 9 people were killed. Several others, including firefighters, were injured. The truck driver is said to have been traveling from Richards Bay in KwaZulu-Natal to Botswana when the truck, of course, stuck under a bridge and caught fire before it exploded. SABC News reporter Patricia Fasahi and video journalist Thabo Mthweni join us now for a live update. Patricia, thank you so much for your time this morning. So, does the death toll still stand at 9?
Well, good morning and Merry Christmas to our viewers. Certainly the community of a plantation here east of Boksburg, it's not a Merry Christmas for them. It's a grim one, it's a painful one, it's one that's filled with a lot of devastation. I just want to give you the shots. The Minister of Health, Dr. Joe Phaahla, here with his team, they have actually embarked on a walkabout through the Tambo Hospital here in the heart of plantation. Just to do reassessments following yesterday's obviously big explosion here that claimed many lives. We await the minister to give us a proper update in terms of what exactly the latest statistics are, where does the number stand, in particular the fatalities and of course the number of injuries. We have learned that amongst those who have passed on are 3 officials who have also lost their lives, but the proper updates will happen shortly. But we just want to show you, the aftermath. There's a lot of debris here. We see people's clothes right here. Just if the camera can pan to this side, you'll see that there's a burned t-shirt. Thabo, if you can just turn the camera to this side here. These are some of the pieces that reflect exactly what happened, and we're going to walk to that wall. There is perhaps even a clearer evidence of the aftermath. There's a lot of shoes lying there, burned shoes that perhaps show you what happened to some of the owners of these shoes. Here you have another pair of shoes. You can see there's somebody's cell phone that also went up in flames. There you've got another pair of shoes across the road. So it's shoes everywhere. It's containers, food containers, perhaps as people were running, some of their belongings falling apart, staying behind. There's pieces of flesh that you can still see. So it's really a very graphic aftermath as all these pieces that are lying here. There is somebody's wig that also stayed behind. And the big question really is, as all these pieces lie here, the shoes, the pieces of flesh that we see, that wig that you see on the screen lying there, the pair of shoes, the clothes that are burned, you ask yourself, where are the owners of these material? What happened to them? Are they among the survivors, or are they among the fatalities? Who are they? It's so many questions. And I'm just going to also try and give you a shot, if possible, through this fence here, if it is possible. There you can see parts of the actual accident scene. So we literally a stone throw away from where the accident took place. You can see the bridge, part of it. You can see there's still a lot of onlookers, community members who came back to talk about what happened here, talk about the devastation, cleanup operations that are also underway. You can see there's a house here that is burned. You can see the wall that is burned down there. Also, some of the homes that were in close proximity to the accident scene that lost so much, windows that were shattered. And just there by the corner is one of the homes where we interviewed the family, where both a father and son passed on in the blast, and that was when the second explosion happened. Good morning, sir. How are you? Merry Christmas. It's a bitter one for the community here. See, many of you are just walking around trying to still make sense of what is happening. This morning, what is the sentiment? What's the feeling?
Well, the feeling, I think it's my brother's here in hospital now, and it looks bad, huh? Very bad. Yeah.
And it's definitely not a Merry Christmas for many of you.
No, it's not. I mean, all these patients in the hospital, something could have happened to them as well.
Apart from your brother, did you have any other relatives, friends, perhaps?
No, nothing.
What's the most important elements that you as a community need to make sure that you return, your dignity is restored, your peace in this community is restored, you can feel safe again, infrastructure is restored? What do you immediately need?
Security. That's all what I can say. And plus, the drivers must be careful what they drive. I mean, the driver, I don't know. I don't say it's his fault, but I'm also a driver myself.
A truck driver?
Yes, I'm also a truck driver, and
So when you see a devastation of this magnitude and you hear the stories that the bridge was clearly marked, that it has a limit, as a driver, what do you make of it when you see an accident like this, knowing very well that there are signs that show that you can't pass, yet the driver passed?
Yes, I think so. But I can't, I was not here, so I can't really say. That's my...
All right, thank you so much. And I think that is perhaps the sentiment. A lot of people are just, they're in shock, they're confused, they're wondering whether they'll ever make it past this. And this is certainly history for them. This is an incident that they will remember forever. For years to come, it will probably be marked even in history books as to what happened in this community. But as I said, we await an address from the Minister of Health just to give us an update and also to tell us more about where do the fatalities, the injuries stand, and what is the plan forward. What does he make of the assessments that he just conducted, and what does that mean to him as the Health Minister? What plans does he come forward with? So we'll have to get inside just to make sure that we don't miss that briefing. We'll come back to you shortly with the briefing from the Health Minister.
Patricia Fasachi, let's leave you to it. And of course, we'll be touching base with her a bit later on as we continue to track developments on this story right here on the agenda.